Ladies and gentlemen, thank you for standing by. Welcome to the webinar Wednesday's Report from Frankfort on Health Happenings. During the presentation, all participants will be in a listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Wednesday, January 29, 2014. I would now like to turn the conference over to Rachel Seeger. Please go ahead, ma'am.
Thank you so much. Good afternoon. I'm Rochelle Seeger, Community Health Research Officer at the Foundation for a Healthy Kentucky. Thank you all for joining the webinar today. This webinar is a part of the Foundation's Health for a Change training series. This free series is comprised of webinars and in-person workshops designed to support the efforts of Kentucky's community health coalitions, agencies, health advocates, and interested community members. The Foundation for a Healthy Kentucky was founded in 2001 with a mission to address the unmet healthcare needs of Kentuckians with three main focus areas. Promoting responsive health policy aims to make public policy more responsive to the health and healthcare needs of the people of Kentucky. Investing in Kentucky's future aims to improve the health of Kentucky's children by engaging communities in testing innovative strategies. And finally, supporting community aims to support implementation or expansion of innovative strategies to improve the health of Kentucky's lower-income communities. The Foundation does this by grant-making, supporting targeted health and healthcare-related research, providing policymakers with the information needed to make decisions which impact the health of Kentuckians, and by offering training and technical assistance through events just like this one. Next, I'd like to direct you to the Foundation's website, healthy-ky.org. There you will find archives of the past Health for Change training series. In addition, today's webinar will be archived there next week, Foundation reports and issue briefs, and upcoming event schedule. On today's webinar, I'm very honored to welcome 4 leaders from Kentucky State Government. They will each briefly describe their department, report on the current health happenings there, and give us guidance on communicating with and learning more about their departments. First, I'm honored to introduce Eric Friedlander. He has served as Deputy Secretary of the Cabinet of Health and Family Services since 2009. Previously, he has served as Policy Advisor and Acting Commissioner of the Department of Behavioral Health, Developmental, and Intellectual Disabilities. A graduate of Antioch University, he began his state government career in 1985 with the Office of Certificate of Need and Health Planning. He has also served in the CHFS Office of Inspector General for 10 years and directed the Family Resource and Youth Services Centers program. He served as manager of the budget branch of the previous Cabinet for Health Services and as the executive director of the Commission for Children with Special Health Care Needs, which provides care for children with physical disabilities. While at the Commission, Friedlander demonstrated his commitment to youth and family involvement, launching the Commission's first Youth Advisory Council and Parent Advisory Council. Thank you for joining us. Welcome, Eric.
Thank you. From that introduction, you can tell I have trouble keeping a job. If we can go to the next slide. Cabinet of Health and Family Services. I've been around here long enough. The Cabinet has at times been together as the Cabinet for Human Resources, apart as the Cabinet for Health Services and the Cabinet for Families and Children, and now we're back together again. I prefer the combined structure. I believe that it keeps more of our agencies working together when they are under one secretary. So about 8,000 employees, next slide, and we have many departments. Medicaid services, community-based services, public health, aging and independent, behavioral health, OIG, of course, our wonderful Connect. These agencies serve many, many people. Next slide. So the way we look at it, we serve cradle to grave. Folks get their birth certificates here, they get their death certificates here, they get marriage certificates, divorce, all of those come through this cabinet, as well as then all the programs across our cabinet, newborn screening, through our public health lab, which by the way is nationally accredited. Any restaurant that you eat out at, a local health department has surveyed that restaurant. Many of them have letter grades. If you have someone in a child or daycare center, we inspect those. Anyone in a long-term care facility, all the healthcare facilities in the state are licensed and inspected by this cabinet. So a tremendous amount of folks that we serve. The food stamp program, the SNAP program that's been in the news recently, that is administered out of this cabinet. We're in every county in the Commonwealth, and we think 1 in 5 Kentuckians have Medicaid today. By the time enrollment and open enrollment is over, we believe we will end up with 1 in 4 Kentuckians receiving Medicaid. Next slide. So those of you who watched the State of the Union address last night, you know that our governor received a call out from the president about how well we have done in implementing the Affordable Care Act. The Affordable Care Act, the way I like to say it is this. There are a lot of folks and a lot of people who have differing opinions of that act. Is it perfect? Absolutely not. But is it a step in the right direction? We believe so. Some of the lesser-known pieces of that act have to do with mental health parity. It has allowed us to make a very big change to our behavioral health system. We're in the process of changing it, bringing us into what we consider to be a modern set of benefits for a behavioral health system. We also are adding substance abuse services and substance abuse treatment in our Medicaid program. Prior to January 1, we did not have a robust substance abuse treatment benefit in our Medicaid program. We really only served youth and adolescents to a small degree and pregnant women, and that was it. Because we have the Department for Community-Based Services in our cabinet, the provision of substance abuse treatment services, we think, is incredible. 80% of all our child abuse and neglect cases relate in some way to a substance abuse issue. The fact that we are, for the first time in Kentucky's history, not only going to offer substance abuse services through Medicaid, remember that's 1 in 4 folks, but also through private insurance because of the mental health parity side of it, it's a very, very exciting time for us to see if services actually will make a difference, and we believe that they will. Next slide. So today, or actually I would say we should go back to prior to October 1. We had 640,000 folks in Kentucky who were uninsured, another 300,000 who may qualify for Medicaid, and another 290,000 that might qualify for the premium assistance known as Connect. Hopefully you heard, again, how we received the nice discussion about Connect from the President in the State of the Union. Not that I'm bragging. Next slide. So we started open enrollment. It began October 1. It runs through March 31st. The website is listed on this slide. If you know of someone who may be eligible, please have them apply. We also have small businesses that are also able to purchase insurance through Connect, and we've had really a much stronger response to that than we expected. We started on October 1, signing up about 1,000 people a day. That we weren't sure we were going to be able to keep that pace, that it may drop off as we move through the enrollment period, but all that's happened is that it's increased. Prior to the January 1 deadline, we got up to about 2,000 people a day, and it really has never fallen back to that 1,000. We are signing up 1,500 people a day. It's very difficult to keep up with our enrollment numbers. On this slide, I have 175,000 Kentuckians who are either receiving now benefits through Medicaid or through the premium assistance side of Connect. Today, as of this morning, we were up to 188,000 Kentuckians. That's how fast this is growing, and we are tremendously excited about that. We never expected to sign everybody up. No public program ever does. But with this initial response, obviously it's been overwhelming to the federal exchange. We, however, were able to keep up with it. But it has been exciting. And I've worked for mainly the health services side of the Health and Family Services Cabinet for a long, long time. And to actually be living through the time where we are going to expand coverage to people. We are going to get them really good benefits in terms of behavioral health and substance abuse. I'm tremendously excited about that, and I think it's going to make a huge difference in the Commonwealth of Kentucky. Next slide. Why do I think that? Well, Kentucky, we call them the Kentucky Uglies. We are last in smoking, 40th in obesity, 43rd, and so you can see in the slide, we are a very, very unhealthy state. And part of that has to do with how we've administered programs in the past. Part of that has to do with that we haven't had really good behavioral health and behavioral interventions, because some of these are certainly related to behavioral health issues. Individuals with severe behavioral health issues die 25 years earlier than their counterparts. It's a tremendous issue. So we believe we are going to see a tremendous increase in demand for all services. Now, I've heard some folks who are concerned that we will not have the capacity. Well, they're right. Capacity of our healthcare system is going to be sorely taxed. Not taxed in the way that Uncle Sam taxed, obviously. But think about it this way. There are no more people in need of services on January 1 as there were on December 31st. The difference is they're going to have a payment source. So we know we're going to get people diagnosed. We know some of these statistics may actually get worse because we're getting earlier diagnosis, but we believe this is the way that we finally turn the corner on the chronic poor health conditions in this state. So we think this is going to make a tremendous, tremendous difference. And actually, the Chamber of Commerce has been behind this because they realize a healthier workforce will make a very big difference when they start to talk about folks who may want to locate their companies in Kentucky. So next slide. You've heard me talk about it several times. Mental health parity is a huge deal. And so this is the first time we get to cover substance abuse. And just recently was announced from the Attorney General has made a settlement with one of the pharmaceutical companies that we're going to be able to provide some seed money for treatment to help those folks who are already in the field but need some assistance setting up their substance abuse treatment programs. We'll be able to provide some startup funding for that. There will be some grants for that. It's going to be run through the Attorney General's office, and there will be an RFP and an RFI, request for information and request for proposal, that should get out on the street fairly soon. So for those of you who are interested in that, please keep an eye on the Attorney General's website and on our website, and you will see more developments as it comes to there. Finally, last slide. Here's the best way to get in touch with us. We have an ombudsman's office. We have constituent services here in the Secretary's office. Angela Hawkinsmith, who has here, I consider her, she can get folks' issues solved. And finally, here's the Connect, here's our Connect website and the phone number. And one other thing I want to mention. Today, actually, in my office, is Jamie Sparks, who will be addressing you later. But the reason he's here is that we have started some, I think, important initiatives with the Department of Education, with juvenile justice, with our own DCBS, with the courts, to try to address youth and adolescent issues related to behavioral health and substance abuse, and looking at screening tools and looking at assessment tools, and how can we all work together better to serve children in schools and children in our communities. It's a very exciting time for that as well. And just the fact that Jamie is here today and we're sharing the office, I think speaks volumes to the level of collaboration that we have. So with that, I will close, and if there are any questions, I'll be happy to answer them.
Thank you so much, Eric, for that fantastic presentation. A lot of exciting things, a lot of work that you all are doing. Next, I'm honored to introduce Tina Garland. Tina is the Farm to School Program Coordinator for the Kentucky Department of Agriculture. She developed and implemented the first annual Farm to School Junior Chef Program, a statewide cooking competition for grades 9 through 12. Working in partnership, she developed the Kentucky Farm to School curriculum targeting high school level students and the Farm to School Resource Handbook. Her passion is to help combat childhood obesity and raise awareness of the importance of local foods. Welcome, Tina.
Thank you. And excited to share today what our department has to offer. We have several programs here in the Department of Agriculture that focus on improving nutrition through fresh, local, Kentucky Proud products. The Seniors Farmers Market Nutrition Program, FMNP, and the purpose there is to, again, improve nutrition to low-income families by providing them better access to fresh fruits and vegetables. Funding for the program comes from the federal and state resources, and the department serves as lead agency for the Seniors Farmers Market program, and that provides seniors $24 in checks to purchase fresh, unprocessed, locally grown fruits and vegetables and herbs at the state-approved farmers markets across Kentucky. The Emergency Feeding Assistance Program, TFAP, again, is a federal program that helps supplement the diets of low-income Americans by providing them with healthy foods at no cost. Under TFAP, commodity foods are made available to local agencies for distribution to needy households for use in preparing meals for home consumptions or organizations that prepare and provide meals for the needy. Recipients of the food for home use must meet program eligibility criteria set by the state. And our website there for eligible details is provided. Also, we have the Commodity Supplemental Food Program, CSFP, and it's administered by the Department for Kentucky residents. The program provides generous monthly packages of food carefully selected to provide broad nutritious food for a well-balanced diet, as well as nutritional education and information to enable our clients to enjoy healthier eating habits and healthier lives. And again, eligibility details are at the website. The Child Nutrition Commodity Program, that is housed again in the Division of Food Distribution, and we coordinate the distribution of commodities for more than 1,600 schools and residential child care institutions providing meals for students. The National School Lunch Program supports agencies by providing cash reimbursements for meals served in schools, but also through providing nutritious USDA donated foods. In 2011-12, our division facilitated the distribution of USDA donated foods valued at over $20 million to more than 240 school systems, serving over 400,000 students daily. And again, the eligibility details are at our website. And the Farm to School program, and I'm going to land on this for most of the presentation because this is what I am in charge of. And it can be basically what the Farm to School program does is creates a non-traditional market for Kentucky producers, connecting them to food service directors throughout the state, enabling them to purchase fresh, local, Kentucky Proud products for their cafeteria. And if we are going to change the food system, we need to think big, and Farm to School is big. The National School Lunch Program feeds approximately 31 million students every day, and Kentucky feeds approximately 130 million students every year. Over the course of a year, schools spend billions of dollars on food. And imagine the impact schools could have if they sourced 50% of the food they serve from local farmers. And this is something to think about as well. We have 173 school districts across the state, but if only 100 districts participated, spending only 6 cents per student, we would generate approximately $3.5 million for our local farmers. And may seem like a tall order, but it's doable. And we are having meetings every day almost, it seems like, across the state, connecting those producers to those food service directors. And we continue to reach out and with our sister agency, the Department of Education, to educate and encourage purchasing from local producers and walking them through the procurement process. Also, we have implemented last year the Kentucky Farm to School Junior Chef Program. Very excited about this program. It's a statewide high school cooking competition designed to offer youth the opportunity to learn valuable skills in recipe development, food preparation, marketing, public presentation, organization, teamwork, and community involvement. This year we have our deadline is listed there. Deadline for application is February 15th, 2014. In-school competitions are being held in March. They will be held in March. District cook-offs in April, regional cook-offs in May, and final cook-offs at the State Fair in August. We have had lots of excitement about this. Last year we had 38 teams that had signed up or applied, and that reached out to over 177 students. And the purpose is to develop a recipe that has at least a minimum of 5 local ingredients, that is food service director friendly, and that meets all the National School Lunch Plan guidelines. So our students, and I have some pictures here for you, our students really just enjoyed doing and participating in the Junior Chef. And some of them had never cooked before, so you don't have to have a cooking club. Some belong to a cooking club. We had different groups, UK Cooperative Extension, the 4-H leaders took a team. Some of the Family and Consumer Science agents got involved. Our family and consumer science teachers throughout the school system got involved. FFA students along with ag teachers also got involved. So it's open to everyone. And these students were in the far western part of the state that competed. And this is Boyd County, and they served a gluten-free dish. And it was really exciting to have those students recognize some of the allergies and things that people are having, and they wanted to come up with a dish that would help some of those students in their school. Now these schools are serving these recipes, and they have them menued, some each week and some each month on their menu. This is a team from down in Whitley County, and they competed with a salad with fresh fruits and vegetables and a chicken, and was just really, really good. And there again, you're teaching nutrition, the importance of nutrition. You're teaching knife skills. And my last or next to last slide is Commissioner Comer and the winners. And as you can see, the young lady holding the great big trophy in the middle, that is our traveling trophy. And it will come back to the state fair next year to see who's going to take it to their winning high school. But also, we were really excited to have Deputy Undersecretary Dr. Janie Thornton with us, and she was just really excited about the Junior Chef program and how it taught nutritional lessons and just the importance of purchasing local and the nutritional value of local and healthy eating, along with Kirk Falkerson with USDA F&S. And also Sullivan University became involved and offered up to $70,000 worth of scholarships to our 4 top winning teams. And again, this year they are will be involved with us this year. And again, the nutrition and the education side of this program is just phenomenal. Dr. Janie Thornton, Deputy Undersecretary Janie Thornton, is wanting to promote this in the southeastern region as well as to all the states across the nation for a program to be implemented for nutrition education. This is my information if you would like to contact me, and that link right there will take you directly to our Farm to School page. But also you see our agriculture website. It's www.kyagr.com, and that will take you to our other programs that we have here at the department, and will take you to any of the food distribution programs if you have any questions on those programs.
Thanks so much, Tina. That's a fantastic presentation. Great to see those kids getting into the kitchen. Next, I'm honored to introduce Jamie Sparks. Jamie, as Eric mentioned, is working together on a project, but he's here with us today to talk about the coordinated school health, where he's a project director at the Kentucky Department of Education. And special thanks go out to him because Felicia Cummings-Smith was unavailable to attend today. So I'm honored to introduce Jamie. Thank you so much for joining us. Welcome, Jamie.
Great. Thank you for the opportunity. And I send my apologies on behalf of Felicia. She had some travel issues and was trying to travel into a conference in Atlanta today, and Atlanta is not doing very well with snow. So I was able to pinch hit for Felicia, and she's been a great supporter. Unfortunately, I mean, it's good for her professionally, but personally, I hate to announce that she's actually leaving the department and accepted a new job with a leadership education group out of D.C. So at the end of February is her last day, and she's been really instrumental in a number of the things that I'll get to share with you today, what's going on with coordinated school health at the Department of Education. So next slide, please. January 6th, the Governor's Office released this announcement. This is the new funding announcements through Centers for Disease Control, which is where the school health initiatives at KDE are funded from. Part of this new CDC State Public Health Actions is actually a new grant agreement with CDC that all 50 states are receiving. 32 states are receiving enhanced component funding, which is additional money. Kentucky is one of those recipients of the enhanced money. So all in all, we're working with a $1.7 million grant for all 4 of those funded areas above. I am proud to say that Kentucky, of those 50 states, we are the only state that has a co-lead at the Department of Education on this type of funding. So that just goes to reiterate the previous work that's occurred between the Department for Public Health and the Department of Education that led into our current funding structure, and also helps to build that synergistic work with diabetes, heart disease, and obesity in our state as well. And as Eric mentioned earlier, those what we call the Kentucky Uglies. And so we've had previous cross-agency collaboration, and this grant only continues to foster that communication and that work that goes out to local districts and local health departments. Next slide. A key component that we created a number of years ago that's really aided in that cross-agency approach to our work has been the Kentucky Board of Education Health Subcommittee. That health subcommittee consists of 2 Board of Education members, a number of staff at the Department of Education, including our policy advisors. You see Dr. Connie White is listed on that. She is a Deputy Commissioner for Public Health. Former Commissioner Hacker served on this committee when it occurred. We also have Susan Zepeda with the Foundation. And then we also have local people with the University of Kentucky, Dr. Andy Henderson with the Chamber of Commerce. And so when it comes to school health, this is really the committee that's taking the advocacy, taking the message from our internal committee, taking it from our education groups and our associations. And with this committee, we're the ones talking about what policies are needed, what policies can be changed, what are areas we can improve, and then also looking at the things that are aligned in the new 1305 grant that CDC has for us. And so this has really been an instrumental to our work and having a place to voice that with the Kentucky Board of Education. Next slide, please. On January 8th, shortly after the bigger grant was announced, the Kentucky Department of Education released a press release from our department, and it highlighted specifically the areas that we were going to be working on in school health within that new CDC funding, that quad grant that I referenced in the first slide. So a number of the initiatives that we're working on over the next 5 years of this funding specific to school health include the development of what we're referring to as our SHAPE network, the School Health and Physical Education Network. That's going to be a statewide network engaging schools and teachers and leaders in the areas of physical activity, nutrition, and staff wellness. So we're really working at a model to implement best practices related to those areas of content. We developed that after what Kentucky Department of Education has done with the implementation of Common Core. So you heard Eric mention that Kentucky's led the nation in Affordable Care Act. We've also led the nation in how we've implemented Common Core, and that's been through this regional approach with our education co-ops. And so that's a project that we're currently working on within this new funding to really deliver it out to all schools for technical assistance and professional development. And so a lot of those goals are related to the goals of the grant: nutrition, physical activity, and staff wellness. Next slide, please. December the 5th, we had a statewide coordinated school health summit. This particular summit was actually completely funded by the Department for Public Health, along with some supplemental funding by the Kentucky Board of Education Health Subcommittee. So this was not actually a part of the federal funding we received from CDC. But thanks to Dr. Mayfield, she wanted the topic this year of her conference to be coordinated school health. And so this is an event that was a huge success and very much a synergistic event for helping us to accomplish what we want to do within our school health goals over the next 5 years. We had 33 school districts represented. Over 350 people were there that day. We were honored to have Dr. Charles Bash from Columbia University as our keynote that day. We've recorded that, and those videos will be released very shortly after the final edits are done. We also had 8 champions that did TED-style talks. We called them unbridled talks around the 8 components of coordinated school health. And so really a great event that brought teams together. They used a WellSat tool. And so really talking about the Healthy, Hungry, Free Kid Act and how it aligns to local school accountability within the new program review. And so gauging that conversation for schools around how do you have these conversations at the local level. And it was a very important event for us and something that we're continuing to build upon and build from. Next slide. So our coordinated school health approach is what I said is going to be through Kentucky SHAPE, and I wanted to make sure to mention 2 critical partners in this Kentucky SHAPE approach that we're going to be doing with coordinated school health. The Alliance for a Healthier Generation has been in our state in existence since about 2008 or 2009. There's currently about 1/3 of our schools that are enrolled or engaged in the Healthy Schools program that the Alliance offers. They have 2 full-time program managers in the state that work directly with schools at the local level on informing and improving programs and policies within their framework. We've worked with them and aligned their framework to our accountability document. And so that's been a real success for us, and you'll see that they play in one of the later announcements I'm going to share as well. The other key part is Humana Vitality. With our grant, we're working on staff wellness, and we know that we have, as we look at education in our state, we know that local boards of education oftentimes are the largest employers in most of our counties. And so Humana Vitality is a way that we're working with the SHAPE network to engage more teachers in staff wellness and some of the incentives that are included in that. So the new Living Well plans that just rolled out as of January 1 only further strengthen some of the work and goals that we had with our SHAPE network and position our teachers to work with the Alliance and Humana Vitality as well. Next slide, please. An announcement that just came out this week. There was a press release on Monday for Let's Move Active Schools. That's a national initiative that has come, originally started with the First Lady, but it has morphed into a number of other organizations and venues, and so the schools element has actually been picked up by the President's Council, as well as AFERD, the American Alliance of Health and PE, Recreation, and Dance. That's our National Association for Health and Physical Education Teachers, along with the Alliance for a Healthier Generation. Those 3 entities are managing partners on Let's Move Active Schools. There's also a number of other sponsors and partners that have come to the table, including Reebok and Nike, Partnership for a Healthier Kentucky. And so with Let's Move Active Schools, it's a way to promote comprehensive school physical activity. This is something that Kentucky's been engaged in for the last 2 or 3 years. Next slide, please. With Let's Move Active Schools, it's a framework that I just referenced as comprehensive school physical activity. Kentucky lacks in physical education requirements for elementary and middle school. In fact, our only PE requirement currently is a graduation requirement for high school. CSPAP, the comprehensive approach with Let's Move Active Schools, is a way that we work with schools in local control to improve PE, but also improve other physical activity opportunities. And so with these partners, there's funding, there's technical assistance, there's professional development around engaging school environments and improving their physical activity outcomes for both students and staff, as well as that family community engagement piece as well. So CSPAP is something that we've embraced for a number of years within the program review, and now with Let's Move Active Schools, our announcement that came out this week talked about Jefferson County. They made a commitment to enroll all their schools in Let's Move Active Schools at our December 5th summit. We have a major semi-national conference coming to Lexington in February. So with the press release that came out this week, it's encouraging other districts and superintendents to promote Let's Move Active Schools as a way to improve their school accountability through all the resources and technical assistance that's available with this approach. And so we're really excited, and we've already had great feedback from a number of districts that want to come and participate on February 20th, in which we'll do a recognition ceremony by the Kentucky Board of Education Health Subcommittee. So that's been a great event, and really excited to share that news that just came out on Monday of this week. Next slide. And the last one of my last slides is tobacco-free schools. In our previous funding by CDC, tobacco was an area that we concentrated on and focused on. In the new grant, it's not specific outcome, but we still do all the partnerships that we've done before. And so anytime that we have an opportunity with coordinated school health, even though it may not be necessarily a part of our CDC outcomes, we still represent the department in any area related to student health, and tobacco-free schools is certainly one of those. 3 years ago, Commissioner Holliday and Commissioner Hacker released a joint letter of support. At that time, I think there was about 12 districts in the state that had a completely 100% tobacco-free policy in place. That's not only in school buildings, but that's in the outside, that's in the auditorium, that's in the stadium, that's in the baseball field, anywhere the school district owns, completely tobacco-free, and that's the policy we've been promoting. Currently, there's 171 schools. That's 32 school districts, so over 1/3 of Kentucky's student population is now covered by a 100% tobacco-free school policy. So we've made a lot of progress in this area. We have a letter that is with Commissioner Mayfield right now that will soon be released, and it's an updated letter from Commissioner Holliday and Commissioner Mayfield encouraging more districts to continue this work that we have with tobacco-free schools here in Kentucky. And I think that was my last slide.
Thanks so much, Jamie. A lot of exciting programs going on. I do want to remind all of our participants to continue to send your chat questions. We'll have a few minutes at the end of our call to have our speakers answer your questions. You can send those through the chat box, so continue to send those. Next, I'm honored to introduce Maggie Woods with the Kentucky Department of Insurance. She joins us to represent the department as Commissioner Clark's schedule has also changed. Maggie, thank you for joining us and welcome.
Thank you all. And the Commissioner apologizes she could not be here, but we'll hop right in. So, okay. At first, we start with our mission statement that we promote sound, competitive insurance market, protect the public through effective enforcement and regulation, and empower the public through outreach and education. I specifically am the Director of Health and Life Division, so what we do, and then I'll explain the other divisions, is we regulate insurance companies and HMOs offering various types of health and life insurance products. Obviously, right now, our health side is a little bit busier than our life side, but that's just the way it goes sometimes. We also have 6 other divisions. We have property and casualty, legal, fraud, financial standards, agent licensing, and consumer protection. The one that most Kentuckians are familiar with is consumer protection, because that's really where Kentuckians can call in with complaints or concerns or questions, and we sort of try to route it to the right area. So the approval of rates, the Health and Life Division approves all the policies and the rates for insurance policies sold in Kentucky. So this will kind of break down how it happens, and insurers that offer health benefit plans in any of the market segments must submit a rate filing to the department before rates may be used. We have the authority to review all individual, small group, association, and employer-organized associated rate filings. We also have the authority to disapprove or request modifications of rating factors. Within the large group market, we also review the rating methodology used to determine any rate, and we do that through our actuaries, and usually there's some back and forth with the issuers, actuaries, and ours to make sure that the rates that are being charged for the product make sense. The other side of that is the forms, and they sort of go hand in hand, and they also must submit a form filing to the department before they can be used. Again, they can be approved, disapproved, or we can ask them to make modifications. And the application policies and schedules must be approved by us. Consumer protection. Obviously, our commissioner used to be the director of consumer protection, so it holds a special place in her heart. We work with them very closely with complaints and concerns they get from Kentuckians. And it's been around since 1998, and we work with them very closely, especially now with all the changes. As you can imagine, we're having a lot of people call trying to understand new product and what's going on with them, and we try to work through those with both the issuers and the consumer. At the bottom of that is a link to an online complaint form. If you or someone you know has a question or concern about their policy or just insurance in general, they can send it that way. Utilization review is done here in the Health and Life Division, and that's when people's claims are denied. And there's a process, and eventually some of them end up here at the Department of Insurance. So we register all the entities that provide utilization review in Kentucky after a thorough review of applicants' policy, procedure, and template letters. The registration process is completed every 2 years. UR is performed for the purpose of determining the availability of payment in relation to medical necessity and appropriateness of medical services given or proposed to be given to a covered person. Department of Insurance never makes a medical decision. That's not our job. Our job is to look at the policy and the law and see if we can make a decision. Like I said, we're not doctors, so if it comes down to a medical decision, that has to be made elsewhere. Consumers have the right to know why, if they've had a claim denied or terminated, why that's happened, as well as the rights to an appeal. And at the bottom there, you can click on how to file an appeal. It'll walk you through the process and make it a little bit clearer, because it can be a confusing process. A lot of times, especially now, people are wondering what's the difference between the exchange and the DOI, and this kind of gives you just a little understanding of what we are. We're the regulator of insurance policies, and as such, we approve the policies and the rates to be sold. Whereas the exchange sells them, they work with a subsidy calculator, which we do not do. We just make sure there's legal compliance. So a lot of times right now, people are trying to understand what the difference is. This kind of gives you a little bit of a very boiled down what the roles are for both of us. Current issues going on in the health and life is obviously implementation of the Affordable Care Act through this year. Lots of changes come down quickly, so we try to move quickly to understand the best route we can make for Kentuckians. We're trying to obviously work with state and federal guidelines to marry them together, and making plans for open enrollment for 2015. So we're starting shortly to be getting those for next year. And we included the insurance card because that's been an issue right now. So if anybody's having trouble with their insurance card, there's a number there that they can call. Our other issues that we're really working on is just behavioral switches, because people are used to insurance that they've had. If they have gotten new policies, we just want to make sure they understand what's covered, what's not, because it will be a change for some people. And I've given you the information. If there's any questions, feel free to email us. We'll get back with you. And if we don't know, we'll find out or we'll send you to the right person.
Excellent. Thanks so much, Maggie. A question has come in for you. If a person is denied, their claim is denied, what should their first step be?
Their first step should be an internal appeal with the insurer or the issuer. And when they get the denial, when they get the letter, they need to go, it's usually on the second page because they're usually 2 pages long, and it clearly shows what they need to do. There's usually a mailing address where they need to send it back. But that's definitely the first step because we have to do it. We can't skip any parts of the appeal process. We have to do it in order.
Okay, and that's the first step.
Yep, internal appeal would be the first, and that's within the insurance company, whomever that may be.
Excellent. Thanks a lot. Next, a question has come in for Tina. Let's see. Tina, are there requirements of the school districts to be involved in the Farm to School program?
There are some requirements or suggestions that we do make that they follow, and that number one would be that the producer would be GAP educated, which is free through the cooperative extension agent, and also that producer carry a liability policy. Again, it's not a requirement, but it is a suggestion.
Very good. Let's see, Tina, stay on the line. Another question is coming for you. Let's see. Tina, what is the criteria to be an approved state farmers market?
They need to register that market. A market can be registered with KDA at any time during the year, but to be included in all listings and take full advantage of opportunities, the market should register each year by May 1st. And to register a market, I would contact Sharon Spencer at 502-564-4983. She does take care of the Farmers Market program. And our Seniors Farmers Market is under Jessica Hinkle at 502-573-0282.
Thanks, Tina. And if I may add on my follow-up question to that, about how long does that process typically take? Weeks, months?
How long does...
If you had to guess. The application
of which process? The
for
filing?
Farmers Market. Yeah.
Oh, you know, I would say probably within a week.
Oh,
but
super.
That's just a guess. That's not my program, and I'm just throwing it out there.
Very good. Thanks. Let's see, Jamie, on the call, we have one question that is coming for you. How do we get involved in some of your programs like the 100% tobacco-free schools?
Their tobacco-free website, you can, and it was tobaccofreeschoolsky.org, has information. Elizabeth Hoagland Anderson, she's actually the youth tobacco coordinator at the Department for Public Health. Feel free to email me. My email is jamie.sparks@education.ky.gov. I'd be glad to provide any other information or resources for any of the programs I mentioned.
Thank you. And I want to remind all of the participants that our call is being recorded and will be available at the website you see here. This is the Foundation's website. We have a lot of great trainings up there. I want to thank all of our speakers today. Fantastic list of what's hot and what's happening and all the work that you're doing in Kentucky. It was exciting to hear all of the new grants and the synergies and the collaborations between departments. I was really excited about that. I also want to thank all the participants on our call today. I'm very glad you joined us. I'm also extremely interested in your feedback about today's webinar. So this afternoon you'll receive an email with a link to the post-event evaluation. Today's webinar, What's the Health Happenings in Frankfort, was a request from you all. People wanted to learn more about the different departments in Frankfort and what each did and what was going on and how they could get involved. So this webinar today is a response to you all. So I'm open to your suggestions, and if you would kindly complete that evaluation to let me know how we did on today's webinar. I'd also like you to mark your calendars. We have 2 upcoming Health for a Change training series. Our next one will be in February, another webinar. The topic is health equity. We'll have experts speaking about health equity and how that can be practiced. Friday, March 14th, we'll have a workshop. That'll be an in-person workshop on business planning. Excellent trainer is going to come in and talk with us about Business Planning 101, and that's an all-day workshop that will happen in Louisville. Those two registrations for those two events will be forthcoming, so keep an eye out for those. And finally, I just want to let you know that I'm so thrilled to be with the foundation. Excited to hear all the fantastic work that's going on in Kentucky to further the mission of the health of Kentuckians and improve their health outcomes. I want to thank everyone on the call today for their participation. I look forward to advancing the Foundation for Healthy Kentucky's mission of addressing the unmet healthcare needs of Kentuckians. Thank you all very much. Have a great afternoon.